Thank you guys for joining us today. We're just going to get started now. So today we partnered with the NAACP. Phyllis and Janet, thank you for having us. My name is Farah Marslin. I'm part of the Healing Coalition. And I will pass it to Phyllis just to open us up, and then I'll give you a little background about the coalition itself.
Thank you, Farah. Good afternoon, everyone. And welcome to the Overdose Awareness in Brockton event. I am Phyllis Ellis, president of the Brockton area branch in NAACP, and on behalf of our branch, we welcome all of you. We are joined here today with the Brockton Hill Coalition. Can you hear me? Is it on? Okay. The Brockton Hill Coalition is part of the Massachusetts Healing Community Study, a federal-funded multi-year initiative to learn more about how to reduce opioid overdose deaths. HILL stands for Help in Addiction Long Term. I would like to thank Janet Trask, who is the chair of our health committee and who helped put this event together. We have wonderful panelists today, and they will discuss the overdose awareness in Brockton later on. And our goals today are to develop an awareness on the increased presence of fentanyl in drug supply and the danger to Black community. To inform the community members about how to talk about the dangers of overdoses and provide a personal account from a local community member. Inform community members about naloxone and how it is used to prevent fatal overdoses, and to inform and provide resources that are available in the community. We know there are health disparities among people of color. We know this for a fact, okay? The biggest factor leading to overdose deaths among Black people is the more toxic, illicit drug supply that we have going on in this city. Black people with substance use disorders also frequently lack health care and drug treatment. It is getting worse. Over the past year, fatal overdoses topped 100,000 for the first time in 2021. And the leading factor is the illicit drug supply. The street drug supply is becoming more and more toxic. Black people are more vulnerable because they often rely on illicit drug supplies that are even more at high risk. We can and we must do better. There are resources tables here today, so please take a moment to stop by and see what they have to offer. At this time, I would like to welcome back Farah Marslin, the Community Engagement Facilitator. Farah will introduce all the panelists who will talk more in detail about drug overdose. There will be a question and answer afterwards, so I hope you guys will partake in the questions and answers and ask all the questions you need to ask about drug overdose. Thank you very much.
Thanks, Phyllis. So just to start with the presentation, so today, we're going to, well, before I start, I just want to highlight what the Healing Community Studies is. So it is federally funded by the National Institute of Health. Our goal for the overall study is to reduce opioid deaths by 40% across 4 states. So here the 4 states are Massachusetts, New York, Kentucky, and Ohio, and there are many communities within each state that are involved in this effort. Here in Massachusetts, we are based out of Boston Medical Center, and our goal is to build coalition members and use data-driven decision-making as a process to implement interventions in the communities so that we can do the following. We want to distribute as much naloxone as possible, educate people about overdose in the community, increase access to medication for opioid use disorder, and improve safer prescribing practices across Massachusetts. As Phyllis mentioned, our goals for today is to develop an awareness of the increased presence of fentanyl in the drug supply and the danger to the Black community, inform community members about how to talk about the dangers of overdose and provide personal account from local community members. And then we also want to inform community members about naloxone and how to prevent fatal overdoses. We also want to inform and provide resources that are available in the community. And also today we want to reduce stigma. So here on my right over here is our beautiful panelists. They will all come up one by one and give you an overview, but I just wanted to highlight exactly what they'll be talking about today. So first we have Patrick Forde, who is our clinical coordinator at Old Colony YMCA in Brockton, and he'll give us a contextual overview about the disparities in the overdose deaths in Brockton, and he has data to inform you guys further. We have Will Newton, who's a praise and worship leader at Universal Missionary Church in Brockton. He'll give us a personal account of his journey through addiction. And we have Alba Cordero Soto, and she's a registered nurse at the Harm Reduction Clinic here at the Brockton Neighborhood Health Center. And she'll give us some resources and programs that are available at the Brockton Neighborhood Health Center, and also speak to harm reduction in general and highlight the mobile unit that we have here in Brockton. And then we have Lourdes González, and she's from a prevention coordinator at High Point Prevention Treatment Center, which is an addiction treatment center here in Brockton. And she'll do a Narcan training for us, which we have as a resource for you guys in the back to take home. Just some housekeeping items. We have about 15 minutes each for each panelist to go through their presentation. We recognize that this is a pressing issue, and we'll allow 2 minutes in between each presentation and like Phyllis said, we'll have time for questions and discussions afterwards. But I just wanted to highlight, if anyone can scan the QR code on the screen. This is just a presentation it's a Zoom that we will host next on May 18th. About 2 weeks from now, I believe. And this presentation will focus on gaining insight into the local challenges and resources to the opioid crisis as shared by people who use drugs in Brockton. And then this particular presentation will provide insights and findings to the Brockton community that look at factors driving the rise in overdose deaths among people who use drugs who identify as Black and African American, and explore possible implications and responses. So this presentation will be given by Tracy Green. It's via Zoom, so I just included the flyer here for you to scan if you guys are interested in joining that event at 9:30, May 18. So we'll start off with Patrick Forde, who will give us a background on data and give a contextual and set the tone for us today.
Thank you, Farah. So as she said, my name is Patrick Forde. I'm the clinical coordinator at the Old Colony Y Mental Health Clinic in Brockton. Our clinic has been working with the HEAL Coalition, and we received a grant that allowed us to do some collaborative work with the OBAC clinic in Abington, which is a clinic that provides medication for opioid use disorder. And our role there is to provide behavioral services. So that's kind of like the connection between the Old Colony Y and this particular study. So this afternoon, I am going to be presenting data. This is data from the Department of Public Health that kind of will depict what the overdose trend looks like in the city of Brockton. So I'm going to basically start with an overview of opioid overdose deaths among Massachusetts residents in general. So the very far right, that graph is depicting all of the overdose deaths, including of all races, okay? And it's covering the years of 2014 to 2020. Each color that you see, each bar represents a particular year. So as you can see in the first group, so we have all races. You would notice the trend up, then it comes down, kind of plateaus in 2020. Then they separate that data out into white non-Hispanic, and you will notice that trend goes up and then down again, ending with the red bar is 2020, which is the year for which we have the most recent data. We don't have 2021 as yet. Then we move to the next one, which is black non-Hispanic, and you can see a steady climb up, little climb down, and then between 2019, that number jumps up from 22 to I think 34.8. And then with the Hispanic population, there is a climb as well. And then the last one that, I don't know if you can see from here, but that last category is Asian, Pacific Islander, and non-Hispanic. So you can see in Massachusetts in general, as we take an overview of the state, there is that jump from 2014 at 11, and it triples by the time we hit 2020. So let's look at the statistics for the city of Brockton. So there's good news and there's bad news. So here's the good news. The overall trend in Brockton, and the years we are looking at on this slide are 2017 to 2020. So you can see we start off at 50, we dip, we go back up, but in 2020 the trend is downward. So that's the good news. Overall trend in Brockton is down, and I think we should, kind of talk about the fact that the good work that some of the organizations who are here today have done in the city of Brockton to contribute, some of the panelists as well, to contribute to that downward trend, the agencies that provide care for people with opioid use disorder. But if we tease that, if we break that down now and separate into race and ethnicity, you're going to see a different trend, and here's the bad news. For white non-Hispanics, 50% of the overdoses are down. For Hispanic, no change. For black non-Hispanic, you will notice we start off at 10 in 2017, we end up at 20. There's a doubling of the overdoses over that period of 4 years. And that's really the reason why we're here today, is to bring awareness to the fact that even though the trend in Brockton is down, if we look at people of color, that trend is very disturbing. The other thing that I'm going to point out to you at the very bottom, you'll see the asterisk there, and I need to note that 40% of the people who identify as black non-Hispanic who overdosed identified as Cape Verdean. So that's another thing I wanted you to just keep in the back of your head, that about half the number of overdoses are people who identify themselves as Cape Verdean. So why does this disparity exist among people of color in the city of Brockton? We've got a few suggestions here. So in terms of opioid use disorder, the treatment, one of the most effective treatments is medication. So things like Suboxone, methadone, Vivitrol, which you might have heard of before, are really, I don't want to necessarily say the treatment of choice, but it definitely is an option to help people to prevent overdose and also to avoid relapse. However, what we have seen in this city is that people of color are not accessing those services at the same rate as people who identify themselves as white. So that's the first thing. In my work with the OBAC clinic in Abington, which is part of Signature Healthcare. Signature Healthcare is the largest hospital in this region, and that's where a lot of referrals come from. When we look at the data, we're not engaging people of color, and we kind of don't know why. That's something that we definitely have to look into, but it's definitely a concerning trend, because if we could get the message out there about medication for opioid use disorder, then we could prevent overdoses. The next reason we believe that this disparity exists is that there has been this ongoing kind of like ideological debate in this country about what is the reason for substance use disorder. Some people believe it's a criminal activity that needs to be punished with legal consequences, versus the people who believe, most of us in this room, that this is a medical disorder that needs to be treated medically. But historically, what we have found is the way that policies have been enacted in the United States have focused more on the issue of this is a crime that needs to be punished. And I've just set out kind of like a little bit of a history there, beginning with the Nixon administration, going down through Reagan, and ending with Clinton's tough on crime legislation, which has negatively impacted people of color in the country in general. And I will share another slide here just to talk about the incarceration rates in the United States compared to other developed countries. I think this is other NATO countries, and you can see how far the United States is ahead of everyone. So one of the ways that we kind of deal with some of these social problems in the United States, unfortunately, is incarceration, leading to these high rates. And we know that this has negatively affected communities of color. So we still wonder if that message is still in existence in black communities, that this is really an issue, a criminal issue, and not a mental health and medical issue. You know, there's a saying, if you only have a hammer, the only tool you have is a hammer, everything looks like a nail. Some of you are nodding your heads. So if all you have is incarceration, everything looks like a crime. But there are other options for people with substance use disorders. So how do we deal with this problem of the disparity that we see existing? So we would suggest that one of the things we really need to do is to increase access to effective medications. Increase access to people of color. Because right now, we are seeing engagement from the white community, but not as much from the black community. So that is definitely something that we need to address. The other thing is, I told you to keep in the back of your head, 40% of the overdoses in Brockton are people of Cape Verdean identity, where there is a language issue. So the other thing that we need to really think about is providing treatment in safe spaces with diverse and culturally responsive staff, meaning also people who have the language capacity to engage with that population. And then finally, we would suggest that we need treatment that addresses related social factors and health conditions, things that impact communities of color. It needs to be a more holistic approach to treatment, and we believe that these things would help to increase more positive outcomes for treatment. So that's basically the end of my presentation. And I just wanted to pay tribute to Becky Smeltzer from the Healing Community Studies and Rachel King from Boston Medical Center, who helped compile data and helped me with the information to put together this presentation. Thank you.
So now we'll move on to our next panelist. I will be sitting with. So we'll start off with our first question. Can you tell me a little bit about your journey through addiction and recovery?
Hello, everybody. My name is Will Newton. How you doing? Long time no see. First of all, I am the leader today of praise and worship leader of our Universal Missionary Church under Pastor Roberto. My addiction began at a very, very, very early age. It's real crazy. I wouldn't wish that on anyone. I was 13 when I had my first drink. Started with alcohol, and it seemed normal to me because of the simple fact that I am the last one of 13, and all of my older brothers drink, my sisters drink, and my dad was a full-blown alcoholic. On the other side, you had my mother who had me in church all the time. So there was always this tug-of-war with me when I was growing up. And see, the reason why I ran with this alcohol, I remember as I learned through recovery, is that, when I was such an introverted child at 5 years old. There was so much fear and so much insecurities because of how poor I was in Georgia. No food, no clothes, and then going to school looking at the other kids. So I was such an introverted kid. So when I took that first drink, it made me come out of myself. It made me feel the confidence and the courage, so I ran with that. Later on, though, I know I'm jumping around a little bit. Later on, I learned that if my parents had have gotten me the proper counseling when I was a kid, then just maybe I wouldn't have ran to this alcohol. It's so much that I've learned. But anyway, I ran with the alcohol for years, and then I remember I was with this band. I believe I was about 16. These guys hired me, and they was telling the club owners I was 18. They were in this back room, and I kept wondering what I was doing in this back room. I'm a 16-year-old. I was the lead singer. I sang like a man when I was 15, 14. So they hired me and told the club owners I was 18. So they keep running in this back room, wondering what they're doing. Very inquisitive. So they allowed me in that back room. I started my first line of coke. And that's where the drugs began, right there. And it turned into crack, it turned into shooting dope. And that's when I began to lose jobs. That's when I began to lose houses, cars, apartments, relationships, you name it, I lost it. And that's when I ended, and then some 20 years later, I end up in the Mainspring shelter. Now, I've toured the entire world with a doo-wop group, making hundreds of thousands of dollars. I'm fired. I'm in the Mainspring shelter. No job, no way to work, no sense of direction. And I remember walking down the street from the shelter one day, right across the street from Universal Missionary Church. This is some 11 years ago. Someone told me that they served breakfast in that church, and it was raining. So I went in this church to get out of the rain, y'all. So I thought. But see, God had another plan. See, God had another plan. I thought I went in there to get out of rain. My pastor, Roberto, was just putting the church together. And so he was asking if anybody have a testimony, anybody know a gospel song they want to sing. And I remembered one song, because again, I was raised in the church. My mother took me to church forever. You know, all the time we ended up in church during revival. You was in church all day Sunday from 7 o'clock in the morning to 10 o'clock at night. Y'all know how I go if you're from down south. Anyway, I sang the Old Rugged Cross. And I need to say, from singing that song, the Old Rugged Cross, when I thought I walked in there to get out of the rain, I've been clean 11 years. I haven't shot no dope in that park next to that church. I haven't smoked no crack in that park next to that church. I haven't drank no alcohol or smoked no weed in 11 years. I'm not perfect by no means, but I know that this has worked for me. And that's why, you know, I was share with people a lot of times, you know, I'm a professional vocalist. I know I can pick up the mic and go in the biggest churches with the biggest choirs, with the biggest keyboards and the biggest congregation and just blow that choir away because I have such a passion for what I do. But I choose to stay right here in this community because these are people just like me who I can identify with. And I believe, and I know that's where God put me at. Amen.
Thank you, Will. Your spirit is so infectious, so this is why I love talking to him.
Well, thank you.
But we have another question for Will. What do you see as barriers for recovery for people of color?
One of the first things that I know that like I said, I'm down in the trenches in my community. And I talk to a lot of people that want to get clean that I know. And first of all, I'd like to share that most of the people that I know that are out there still using today, they're good people. But people that drive by us, I say us because I come from there, I'm not there now. People that drive by us and walk by us, and that stigma thing I was actually about, you know, because they will say, oh, them people no good, they bumps. And half of them don't know when I was out there that I didn't travel the whole world, made hundreds of thousands of dollars, because they don't come out there and talk to me. And meet the engineers I met, and meet the professors I met, and meet the nurses that I met that just happen to be, you know, strung out on drugs. But that's another question that I will get more into answering. But what I'm getting at with the barriers is, a lot of it is our criminal history. You know, we want to go get help, but we want to know if we're going to go to arrested if I go and try to seek this program. You know, do I have enough insurance? That's one of the things that a lot of people always talk about, you know, before they want to go get treatment, is they're going to get locked up, or if they're going to, you know, this and that. So there's a fear, a lot of that out there with that. Okay?
Thank you, Will. The next question is, what has been your biggest support through recovery, and what has helped you through recovery?
I go straight to God. But I know it's the individuals right here on earth, but God worked through them. You see, I know, like my pastoral brother I share, for instance, right? He said that God put a calling on his heart to open that church up there so they could help us out there in that park. And so I like to share with him a lot of times when I'm doing my testimony at church and I'm singing. I look him right in the face and say, Pastor Roberto, I stay right here in your face so that to remind you that I am one of those who lives you saved. Because 11 years ago, I was strung out a prisoner on my own mind. You know, I wanted to stop, couldn't stop. You know, so I know it was the grace of God. But I did start out in the AA to answer more detail on her question. I started out in AA, and I used to do AA, and I used to do church, and then, like I said, I walked in and I met Pastor Roberto, and he started inviting me to come to, first he hooked me when he said, well, I want you to become the praise and worship leader. See, it gave me a commitment now because I have a passion for singing. Oh, the praise and worship leader I can't use now. I got to sing these songs on Sunday, which I love to sing so much. So that gave me a commitment, and I knew that. And it's sort of like the same commitment that they give you in the AA. They give you commitments in the AA. You want to make the coffee. You want to be the greeter, or the speaker, or the host, or whatever. So they gave me the commitment to be the praise and worship leader, which was perfect for me. You know, and I think he knew what he was doing. I don't know, but it worked. Because I knew that I had to rehearse. I couldn't use them about 6, 7, 8, 9 months clean. Now, this is way back. You know, I want to use, some days don't want to use. But I could always go and talk to him, and he would take me to it biblically, or back then it was still AA and church. And then it became all church, because then it became Tuesday night Bible study, it became Wednesday night teaching service, it became Friday night prayer service, and it became Sunday service. You know, that put 4 meetings in place and became all church for me. And that's what has become my biggest support, as well as the congregation, you know, the sisters. We have a small congregation, but believe me, it's a tight-knit congregation that supports each other and keeps each other clean. And the community. My community keeps me clean because I love to share my story with someone out there on the block. We call out there the block, for those that don't know. The park, the block, the stopping gas, the block. That's what we call it, the block. Okay, so the block is where I like to be, clean and sober. And I know God has prepared me for that because, you know, there's been many lives that I've touched and I've helped. I don't push recovery or God down anyone's throat. But if someone comes up to me and says, Will, how do you do this? I mean, they see me living every day clean. So sometimes someone walks up to me and they say that. So they open the door, and then I can share my story. And that's a beautiful thing for them to come back 2 years later, and I don't even really remember them, but they say, hey, Will, your story really helped me. I am 2 years clean. Boy, I got goosebumps when that young man told me that. Amen? Amen? It's a blessing. That's a miracle. I don't know. Did I answer it?
Yes. I know when we were talking, you also mentioned your journey with medications. Do you want to say a little bit about that as well?
Oh, yeah. A lot of people think that medications is not a part of recovery. But, you know, in the beginning, back in the day when I first got clean, I couldn't sleep. Pastor Roberto tell you, I was very, very, very angry. I got these highs and lows. Because, see, I was used to numbing my feelings with drugs. So I didn't know I didn't even know what my feelings and emotion was. A therapist had to give me a list that I had to carry around in my pocket. So I wouldn't get angry. So every time I felt jealousy, insecure, I see you back there, Donna. You identifying, ain't you? Uh-huh. See, because for 40 years, I'm 64 now. I got clean when I was 53. Yep, I started early and got clean late. But anyway, I remember I had a list that my therapist gave me that I had to carry around and look at so that I wouldn't get angry, because all I knew was anger or get high. See? So if I was jealous, I got angry. If I was happy, I got angry. If I was, I didn't know the feelings. I never used them for 40 years, for Christ's sakes. I'd had no normal life. It's crazy. So they had me on these medications for a few years, you know, and it worked because it helped with my highs and lows. Well, bipolar, if you really want to know. Yes, I'm crazy, but not mentally crazy. But anyway, as the years went on, right, I remember one time I ran out of medication or something, and I didn't take them, and I realized I was okay. So the bottom line I'm getting at is that I learned how to live a normal life like normal people without medication. But I did start out on the medication because it's good to put that out there, because a lot of people think that they shouldn't take medications. They think taking medications, you're not clean. You know, but I did in the beginning. And I saw a psychiatrist, and I saw a therapist, and it doesn't mean that I'm mentally retarded either.
Thank you, Will.
Okay.
Our last question is, what is your experience with those who still use drugs and substances in the community, and what would help people seek recovery as an option?
You know, every time I think about that and I see my community and my friends, I call them because I know them all. Some of them I used with years ago and they're still using. It's like I just see pain, heartache, and identification because I've been there. And then I want to, wish there was some way that I could just shake them and say, listen, you know what, there's a way out. I found it, Like today I know I'm a miracle because sometimes I think about it. You come from shooting dope in the park to singing praise and worship in a church. It has to be God. Come on. It has to be God. I never dreamed that I'd be praising and worshiping the God and getting the Holy Ghost and shouting, because that's what happens to me. That's why I know that this is a calling, because when I start to sing and I start to shouting, the Holy Ghost start to talking through me. And I'm not just sitting up here and telling no fib. I'm telling you what happens to me. And it's weird. Sometimes I think, I say, you got to be kidding me. God takes those lost ones and he uses them. What was that question again? What was that question again? Y'all gotta forgive me. I get very passionate when sharing my story and sharing it and sharing about God and sharing about, because where I come from, a prisoner out there, if you ain't excited to be 11 years later and shout about not being caught up, because I'd probably be dead. I'd probably be one of them ODing. But what was the question?
The question was, what is your experience with people who use drugs and substances, and what would help them seek recovery, in your opinion?
I like her. She's good. That's why I wanted to hear this question, because there was something I wanted to share on this question. I believe that when it talks about what could help people seek recovery, see, I know what would have helped me sooner, so that's why I share, because I'm down in the trenches. I'm an addict. I'm a dope fiend who's recovered today. Not recovering, recovered. And I know that because of the grace of God told me I was healed. But anyway, what I wanted to share is why I wanted to hear that question again was because, see, you know what's needed in that block and that park? Professional doctors, professional nurses, professional mental health counselors, professional drug counselors to walk out there in that park. I ain't saying this for you to go baby a drug addict or grab their hand. You have to understand why I'm saying this. See, I say this because of the simple fact that I know some people are scared to go out there because it might be dangerous. Well, I can set you up with a person just like myself who knows everybody, so you'll be safe. But seriously, any way it's possible, what I'm getting at, right? And the reason I suggest this is because, all right, I'm out there in the park using, right? 2 blocks down the road, I can get some help. Now, who you think gonna win? Me shooting that dope, smoking that crack, or going 2 blocks down the road? Now, if you came 2 blocks down that road and you said, excuse me, young lady, would you like me to talk to you about how you feeling about losing your kids today? So you might not have to shoot no dope because of the pain you're in. Just someone to come and talk to her. That's a her. But what about the guys and some of the other girls too that you just might could reach because you're there? What about the guys and the girls that are diabetic out there that needs somebody out there to help them suggest that they take their medication so that they don't OD? You say you want to prevent ODing? What about the people out there with high blood pressure who might need to be reminded to take their meds? What about this guy who hasn't checked his his sugar, in a while, but he's just got through eating a bunch of cake? Sometimes if people came out there to us, There are a lot of lives you could save. You could prevent some ODs. That's why I say professional people that know about medication, professional people that know about counseling. But I'm talking about professional doctors and nurses and volunteering their time coming out there. Because, see, we always have people come out there and give us food. We always got people to come out there and give us coats and clothing. I'm not knocking that. That's great. That's great. But, see, really, as a recovered addict, I know it starts in the beginning. So many other lives can be saved, and I have such a pain and passion and heartache for it because I see the suffering out there. You know, I know the suffering because I lived it. You know, and I know what the feeling because I felt it. You know, and I'm just blessed today, and I hope I didn't take up too much time.
It's perfect. So
Thank you.
So Will has given me permission. I know he didn't want to sing live today, but I'm going to share a little video of when he used to sing back in the day. I mean yesterday.
Their classic hit, Only You.
Thank you again, Will. So next we have a presentation by Alba, Cordero Soto, our registered nurse at the Brockton Neighborhood Health Center.
Hello, everybody. My name is Alba Cordero Soto, and I have the pleasure of working at Brockton Neighborhood Health Center, which has multiple locations between 63 Main Street, over by Vicente's, just right on the block, right? We're right on the block. So definitely local support services for substance use to be able to support our community. And I'm excited to be here with you guys to talk about harm reduction. So some of the principles that the objectives we're going to talk about today, we're going to talk about the principles of harm reduction. We're going to talk about the spectrum of substance use disorder, as well as the Brockton Neighborhood Health Centers, the treatment services that we have in our clinic, as well as overdose prevention, specifically with fentanyl-contaminated substances, and what are the trends in some of the substances that we are finding in the Brockton community. Alrighty. So the first thing I want to ask is, how many of you guys in this room are familiar with what harm reduction is by a show of hands? That's a good amount of you guys. That's awesome. Because we all wear seatbelts, right? So seatbelts is a form of harm reduction, believe it or not. Because we can't control how fast or how slow you go, whether you decide to have a few drinks before you go out. You know, we can't determine whether or not you're going to change your behaviors, but we can suggest with that beeping, that annoying beeping noise that's in our car every time we get in there, that you probably should wear a seatbelt because it's safer and it saves lives. Same thing with smoke alarms in our house and helmets when we go bike riding and stuff, right? So I just wanted everybody to understand just how basic harm reduction really is and how important it is in our daily lives, so much so that we practice it every day, right? I come from the day when we used to have like ashtrays in the car. Who remembers that, right? we don't do that no more. The cars ain't got no ashtrays, right? So there are definitely a lot of things that are implanted in our community that are of harm reduction. Now let's see how that applies to the substance use community. So how does it work? So harm reduction is a well-researched, scientific-based approach shown to be effective at decreasing substance use-related harm, right? So to use or not to use, right? So for us, we're not encouraging you to use. We're also not forcing you not to use. We understand that there's a power in meeting a person where they are and empowering them to make their own choices, but doing so in a way that is safer, right? And really just accepting you how you are today, because we're all adults and we all have willpower, that lovely thing that God gave us back in the day. Yeah, that keeps tripping us on some rocks and things, right? So that willpower will catch us up in some challenges. And we want to make sure that we're respecting people's ability to make their own choices. And sometimes that means that they're going to use, and we're going to show them how to use appropriately. So there's two sides to the coin. So one is what are the benefits to their experiences as well as the consequences to their action. There was a nurse that works with me that expressed to me just a couple days ago in supervision. She was like, not everything about when I used drugs was bad. I saved 6 lives while I was out there. And had I not been out there, those people would have been dead. Because when they overdosed, everybody ran. And I told them, I'm going to stay with you until the ambulance comes. And that, to me, was so moving, because I don't think that those stories are told enough in terms of what are the benefits to you being out there. A person that is struggling, right? But needless to say, you have a good heart, you have good intentions, you're still able to make a difference anywhere you are, right? So it's important to understand that it's not all negative consequences in order for us to really see two sides of the coin, right? Right here, right now. Harm reductions are goals in decreasing more than the immediate harm, but more so increasing the quality of life of the individual where they are, right? So while you're here, how can we make sure that you are living the best quality life? Whether that means that you're taking your diabetes medication, whether that means that you're able to find a way to have a visitation with your kids, and that brings you joy, right? So whatever it takes to give you a better quality of life where you are is ultimately the goal of harm reduction. And then the last one is there's no I in win, right? And the goal is that we offer a lot of choices, right? Nobody likes to be told what to do. I know when I was growing up, when my parents told me not to do that, I made sure I did that. And I probably lied about it too. Let me not say that in front of my son, because so people don't like to be told what to do. That's real, right? So for the harm reduction principles, some of the strategies that we use is in terms of giving them safe use supplies, safe use practices, showing a person how to use in a way that will reduce the harm. There are tons of patients in our program that are abstinent, but not all of them. And that means that they're not going to have the door closed on them if they lapse. I don't call it a relapse. I like to call it a lapse, because it's a little rock. You tripped over. As long as you get back up and you're gonna keep trying again, it's okay. You have an opportunity to try again. So, and then the other one is meeting patients where they are. We're going to talk about the mobile services in a little bit, because I think that was a really, really good way of supporting the need of the Brockton community. So for us, our number one goal is to keep patients alive. That's our number one goal. Number two is really any positive change. Any positive change. If you went from using 7 days a week to using 5 days a week, we're going to celebrate that because it's a positive change, right? So, next slide. So we are a multidisciplinary and multilingual team of providers, nurses, medical assistants, therapists, recovery coaches, care coordinators, community health workers, and we're always growing. We're always growing because the need is there, right? So we are here to support you in whether it's your treatment for opiate use disorder, whether it's stimulant use disorder. So just to kind of break that down, so opiate use disorder has to do with heroin, fentanyl, oxycodone, Percocets, that category. And then stimulants has to do with crack, cocaine, methamphetamines, Adderall, things of that nature. And we also treat alcohol use disorder as well. And we're really about really treating the patient as an individual that has dignity and respect, no matter what. And then I also wanted to mention, because we talked a little bit about what's happening in terms of the disparity with the language barriers, right? So one of the things that we have at the Brockton Neighborhood Health Center is we have a robust interpreter services. So what we did was we have a training for them to train them on substance use disorder, on harm reduction. So if there needs to be a third person in the room, we can have a person that's going to be non-judgmental, that's going to be willing to not treat a person differently than what we would do, right? So it's important for us that even if we have to have a third person in the room, ideally we want to have multilingual staff, which we do have plenty, but it's not always feasible. And when that's the case and we have to have a third person in the room, it's really good to have that person also be non-judgmental. Another barrier that was addressed today that I'd like to talk about is that for us, with the substance use program, whether or not you have insurance, we don't care. We don't care about your documentation status. We don't care about none of that. We just want to support you and meet you where you are. So there's no barrier when it comes to that, right? Maybe for other services and other, departments, but when it comes to substance use treatment, we definitely have worked hard to try to remove any barriers, right? So there's a spectrum of substance use, which means that a person can go back and forth amongst this spectrum while they're in recovery, right? Or while they're working through recovery. So there's substance use initiation, recreational drug use, risky use behavior, active chaotic use, early recovery, and long-term recovery, right? So you don't have to be sober in order to reduce, to be a solution for the chaotic substance use, right? If you go from chaotic substance use to recreational, that's great. Right? There's growth, right? So it's important to understand that a person can go amongst the spectrum and it doesn't look one way for everybody. So in terms of the different programs that we have the Harm Reduction Clinic, which serves adults. As I mentioned, we treat alcohol use disorder, opiate use disorder, and alcohol use disorder. Then we have our Moms Do Care program, which is serving pregnant women, such as myself. I don't know if anybody noticed. There's a bump under this dress. Mothers of children, of young children as old as 3 years old, who have any form of substance use, as well as our lovely mobile services unit. I don't know if anyone has seen that yellow craft van that has a truck. It'd be parked all over the place in Brockton, right? All the hot spots, right? So that's pretty much harm reduction on wheels. So we're out there in the community, boots on the ground, picking up dirty needles and doing the work that needs to be done in the community in order to provide low threshold services in order to help our patients get in the door, right? So for the Harm Reduction Clinic, as I mentioned, so it's located on the 5th floor at Brockton Neighborhood Health Center. We offer same-day appointments. We offer in-person as well as telehealth visits. We offer treatment for those 3 substances that I had mentioned. And it's a combination of medication as well as clinicians, behavioral health clinicians. We have recovery coaches. So we have a multidisciplinary approach to the care that we provide. And we also have our contingency management program, which is very unique to us in that we can provide that reward sensor that typically is connected with stimulant use. So when you use stimulants, you get this reward in the brain, and it's important to be able to replace that with something else. So we are able to use evidence-based practice and provide treatment for stimulant use disorder, where oftentimes even when we didn't have the service, we would turn patients away. I'm sorry, we don't treat stimulant use disorder, but now we can, because we understand that there's a need. So therefore, we have this service as well. So with the Moms Do Care program, it's important for us to reduce the stigma that happens with mothering and pregnant women when it comes to substance use disorder, because there's this idea that this mother doesn't care about her children, and that's a lie, right? There's the disease, and then there's a physiological process that we go through, right? So it's important to be able to separate the two and also reduce the stigma in order for mothers to get the care and the support that they need, because this is the time that most people are more likely to get the help, but least likely to walk in that door if they know that somebody's gonna look at them funny, someone's gonna say something, someone's gonna make them feel uncomfortable, right? So we have to be willing to meet these women and provide them that support. So the team includes midwives, social workers, clinicians, nurses, community health workers, care coordinators, and recovery coaches. And they provide non-judgmental, non-stigmatizing prenatal and postnatal care. And that's so important. They support mothers with parenting plans. They help collaborate with DCF, because we don't love DCF, right? They're doing their job, we get it, and sometimes they can be a pain in the butt. But they're able to help advocate for mothers when they can't advocate for themselves, and it's amazing. So provide resources and basic necessities for mom and baby. And then here's a picture of our mobile services. So if you see it in the community, definitely go by and say hi. So this is this harm reduction on wheels. And we have walk-ins that are welcomed for recovery coaches, as well as medical treatment. So we're able to provide treatment and testing on this service. So we do Narcan distribution. We can give Suboxone prescriptions while on the mobile services. We provide safer use supplies, wound care, drug checking. So I don't know if you guys are familiar, but we have this nifty little machine that checks the drugs and tells us what is in it, right? And it can break it down in a way that will give us an idea of what's going on in the Brockton community, so that we can be closer to being able to solve the problem and provide the resources necessary to be able to address it. In a slide in the future, we're going to talk about this drug called xylazine. Not sure if everyone's familiar with it. I know we talk a lot about fentanyl that's contaminated in the crack cocaine, but there's also other contaminations that are happening in the Brockton community that we need to be aware of and know how we can best support that. So we do infectious disease testing as well as treatment on the mobile services as well. So we're going to have a Narcan training next, which I'm super excited about as well. This has been such an amazing panel so far. I've learned so much. This has been awesome. So one of the challenges that we've had is fentanyl-contaminated crack and cocaine that has led to a rise in overdoses. And it's because this person is opiate naive. This person is not used to using this, therefore they don't have a tolerance. So their likelihood of having an overdose as a result of using this is higher. And they might not have the life-saving medication, Narcan, because they don't think that they need it, right? So the different ways that we can support is by doing the drug checking, so that we can be able to see if there is fentanyl in the drug supply. We can always do a urine drug screen after the fact, right? But it's good to know if it's in there before, right? So that's why we also provide fentanyl test strips, so that you can test the substance, and then you can make a decision whether you're going to continue to go to that drug dealer or not, right? Because maybe that's the best decision we're going to make at this time, and that's okay, right? So Narcan training and distribution, as I said, we're going to have a training today, which I'm super excited about. I'm excited that my son's going to see the Narcan training because I want him to know too, right? Because we need to make sure we're saving our youth as well. Distribution of safer supplies, as well as the suggestion, invitation to not use alone, right? Because if you're with somebody, there's a greater likelihood that you'll be able to get Narcan or that they'll be able to call 911 for you. So some trends that are happening in Brockton. I saved y'all some gruesome pictures of some skin lesions, but we're gonna talk about the basics of what is xylazine. So xylazine is an alpha-2 agonist, which is a sedative that is used by veterinary medicine, and it's in Brockton, right? We've checked some substances, and some of the substances that we have are mostly xylazine when the person thinks that they're actually getting fentanyl, but they're not. They're getting xylazine. So it's been in the drug supply in Puerto Rico for about 10 years, and it's worked its way up the community. So the most data that we have is from Philadelphia. So we're able to see some of the effects of the xylazine. So one of the things that we saw was these necrotic lesions, which I told you I'll save the pictures because I know you guys are eating, and I didn't want to make anybody queasy or anything, but and another thing is severe anemia that happens when it comes to this medication. So why is it important for us to know this when it comes to overdose prevention? Well, even though the xylazine can cause respiratory depression, it doesn't respond to the Narcan. So if a person is having an overdose and has mostly xylazine in the drug supply, you give them the Narcan, it will bump off the fentanyl, but it won't bump off the xylazine. So it's important for us to do mouth-to-mouth resuscitation to give the person the life-saving breathing that they need until the ambulance is able to get there. So that's one of the things to consider. And we know it's COVID, and I don't really want to touch people in the mouth. You know, I get it, but having something handy that you can be able to use as a mouth cover, not something, because you don't just want to put a bag over something. No, you know, having the actual cover that you need to be able to do CPR would be ideal, so that if ever you were in the community and you needed to do mouth-to-mouth, that you can do that. All righty. And a lovely case presentation. So we have Jessica, who has been using heroin. Let's be real, it wasn't heroin. She was getting fentanyl because she got it from Brockton. She lives in the block, so it was fentanyl. She thought she was getting heroin, but nah. Well, she's been on and off of it for about 10 years. Jessica stopped using a few months ago, and she was with her ex, but they recently broke up. So she's feeling depressed and anxious and was looking to use again. She buys a bag and heads over to the syringe exchange, where she plans to go back to her encampment in a rush. On her way, she bumps into the mobile services trailer, where she meets a recovery coach that can provide her with Narcan and encourages her to not use alone. And in this moment, it's an opportunity for us to save Jessica's life, because that could have been an overdose. So that's the importance and the beauty of harm reduction. All righty, thank you. And that's how you guys can refer patients.
All right, so I'm just going to pass it over to Phyllis for a moment of recognition.
Thank you, Farah. The Mayor of Brockton stopped by, Mayor Sullivan, so we want to ask him to come up and say a few words. Mayor Sullivan. He's been places. Look at him.
So I've never been this casual before dressed. I apologize, but it is Keep Brockton Beautiful Day. Sydney Merrill, my chief of staff. I know Councilor Shirley Azak. Nice shirt you have on there, Councilor. We were cleaning up today in the city of Brockton, but I wanted to come here and just say thank you to the NAACP. Thank you to President Ellis. We as a community have benefited greatly by all the endeavors, all the educational, informational sessions that the NAACP have offered here and on Zoom. Case in point, the prostate cancer awareness has been a lifesaver for men, not just in the city of Brockton, but in the region. So I want to thank you and Mr. Bernard and the team. But today, this information And first of all, thank you for being here on a Saturday in May. You don't need to be here. It speaks volumes for who you are as a person. I want to thank that information that was just shared, because at the end of the day, what COVID has done to Brockton has really impacted us greatly financially, emotionally, loss of people. But also, if you are dealing with drug addiction or alcohol abuse, it's been heightened because of COVID. The worst thing you can do is, if you're fighting to stay sober, is to be inside a house, right? It's the worst thing. And I've lost a lot of friends in my life in Brockton from drugs and alcohol, and it's a sad piece of fact. And so to be able to look at the resources that are provided in our community, also offered in the educational system, not just at Brockton Public Schools, but at Cardinal Spellman and New Heights Charter School. We need to continue to stay the course. We need to continue to work together. It's about collaboration, right? We are better together. But when we're talking about addiction, both legal and illegal drugs, it's off the charts right now. So Neighborhood Health Center, the VA Hospital, Good Samaritan Medical Center, Brockton Hospital Signature, we're all in this together, right? We need to continue to provide the education and the information. And the idea of helping people is what it means to be a public servant, right? Phyllis doesn't need to be president of the NAACP. She does it because she has a passion and a calling. And that's why you're all here today. So as the mayor, that's my job, that's my title, it's an honor and privilege. But my biggest job is being a dad of 3 kids. So we have to make sure that the next generation, first of all, is not killed out by this epidemic. It's a tsunami. It's killing people every single day, not just in the Commonwealth of Massachusetts or the city of Brockton, but in the nation and in the world. So I just want to say thank you to each and every one of you. It's great to see the young kids here today. We need to continue to talk. You know, when I was growing up in Brockton, it was taboo to talk about coke or crack. It was just taboo. We need to continue to talk because people are dying. You know, when I was elected to the city council, I didn't know what a Skittles party was. I was a kid, and when I talked about, look at me, I like to eat Skittles, right, the candy, but I didn't know what a Skittles party was. And I found out it was when kids go into their medicine cabinet of their parents and grandparents and they take pills. And they get a bowl, like a big fish bowl, and they just dump the colored pills in. And it looks like Skittles, and they pop them. I didn't know what that was. So we need to continue as adults and as leaders in our community, we need to continue to offer the services to the kids, but also to our senior citizens. Because drugs and alcohol abuse, they do not care if you're white or black, gay or straight, young and old. It's an epidemic. So I am just here today to say thank you, thank you, thank you. I want to thank the pastors that are here as well. Their reach in their community, their congregation is far more than me as mayor. So let's continue to roll up our sleeves. Don't be afraid to talk, and let's get the job done and save lives in the City of Champions. God bless you all. Thank you.
So lastly, we'll just, our last presentation just be our Narcan training. So I'm going to pass it over to Lourdes González for our Narcan training.
Good afternoon. My name is Lourdes Irizarry-González, and I am a prevention coordinator for High Point Treatment Center. And today we're going to be discussing an opioid overdose prevention. It's very good that Alba's presentation talked about harm reduction, because this presentation actually comes from harm reduction. It comes from compassion and from seeing the person as a person and not as a drug addict. So High Point Treatment Center prevention services offers substance use prevention to 11 cities and towns in the southeastern part of Massachusetts. This is our agenda for today. We're going to go over what are opioids, what is an overdose, the scope of the problem nationally, and the scope of the problem here in Brockton, risks for an overdose, signs of an overdose, overdose management strategies, naloxone, and resources. What are opioids? Opioids are central nervous system depressants derived from the poppy opium plant. So opioids are a drug that depresses your ability to breathe. That's, in a nutshell, what opioids are. These are some of the examples of the opioids that we can find here in Brockton. As it was mentioned today, our heroin supply is no longer heroin, it's fentanyl. So it's very important to know how fentanyl is impacting Brockton, the Brockton area. So, what is an overdose? An opioid overdose happens when you have taken too much of the drug and your brain is overwhelmed. This results in a lack of oxygen through the rest of your body, and that's the important part about an overdose. This is the scope of the problem. We have had more than 100,000 deaths due to overdose in the nation for 2020, and is the number one cause for natural death. What is the scope of the problem in Brockton? As we saw in my peer presentation, we have structural racism here in the city of Brockton and the nationwide that is causing for health disparities, and we are seeing that the Black community has been disproportionately affected by the opioid epidemics. So the drug supply is another reason why we have this inequity, and the lack of bilingual resources in general, it's another thing that promotes this inequity. What are the risks for an overdose? First of all, mixing other drugs like benzodiazepine and alcohol, not knowing the quality, not knowing, as I said, fentanyl is present here in Brockton, and most of our counterfeit pills are pressed with fentanyl. So you may not know what you're taking, or the person may not know what it's taking, and it can result in an overdose. Overdose clusters, physical health, as I said, overdose affects the way that the person is breathing. So if the physical health is already compromised by a respiratory disease, then the lack of oxygen is going to be greater. Opioids are drugs of tolerance. That means that the more you use, the more you'll need. And tolerance can be negatively affected, or can be not negatively, but can be affected by numerous causes. One of those being the drug supply. If the person is low on supply, then the tolerance will get lower, and when he or she uses again, it may result in an overdose. Previous overdoses, fluctuations in purity, and using alone. When I say fluctuations in purity, we're speaking about what Alba said, that our counterfeit pills are pressed with fentanyl, and that we have other drugs that are present in our drug supplies. What are the signs of an overdose? Awake but unable to respond, body very limp, pale face or grayish color. This is important because if the person is white, you will see a pale face, but if the person is black, you will see grayish color in their skin. Breathing slow, shallow, erratic, or stopped. Cool, clammy skin. Blue if the person is white. Gray or ashen if the person is black. Tingent to the lips or fingertips. Snoring and gurgling sounds. This is because of the lack of oxygen and the lack of breathing from the opioid overdose. Throwing up or passing out. What's the difference between being very, very, very high and being in an overdose? Is responsiveness. A person in an overdose is not responsive, while a person very high may be able to respond, even though she or he might be showing all of the signs for an overdose. So if you call the person by their name very loudly and he or she doesn't respond, and you say that you're going to Narcan them and they do not respond, that means that the person is in an overdose. Or it usually means that the person is in an overdose. How to manage an overdose. First of all, assess the signs that we discussed earlier. The second image, you're not going to punch the person in the face or anywhere else. This is a sternal rub indication, because the bone-to-bone contact, it's very uncomfortable. And if you do that to a person and the person doesn't respond, then that usually means that they're going in an overdose. If you don't feel comfortable going into the person's chest and do the sternal rub, you can rub under the nose, and that bone-to-bone contact is the same uncomfortable feeling, and you will know and assess if that person is going through an overdose. Call 911. Even if you have naloxone or Narcan, call 911, because naloxone is not a medical emergency personnel equivalent. Rescue breaths. This is very important because, as Alba said, the main focus of our intervention is to keep the person alive, and the only way of doing that, other than administering naloxone, is to breathe for the person and administer naloxone. It's very important to note that naloxone has non-secondary effects, and that no allergies have been reported. So it's a very effective drug only for opioid overdose. If the person is overdosing in other substance, Naxalone or Narcan will not do anything. But if the person is overdosing in opioids, I brought a bottle of water here with me to show you how Narcan works. If I take the cap off, I can fill it up with water, right? The bottle is our brain. And when not using naloxone, the opioids can come and pour through the cap. But when we use naloxone, it is like if naloxone is the cap, and I'm putting it all on the bottle, on the water bottle, and it displaces the opioid from the brain, and it takes its place, inducing a response for an anti-overdose. This is a recovery position. This is the position that you should place a person if you need to leave them alone and they are going through an overdose. You can leave them alone to get Narcan, to call 911. So you're going to roll the person to the side. If you have like a heavy backpack or something, you can put it on the back of the person so that the person won't roll back up. The rescue breathing, you need to place the person on their back and tilt their head back and lift their chin up, just like this slide is showing. Pinch their nose, shut, and breathe into the person's mouth. Two normal breaths to start. It's very important to check that the person's chest is rising and not the stomach, because if the stomach is rising, the oxygen is not flowing to where it's supposed to be flowing. Give one slow breath every 5 seconds. That will make 12 breaths for 1 minute. Continue rescue breathing until medical personnel arrives to the scene. Administer naloxone or Narcan. I have Narcan here. It is basically a nasal spray. We're gonna watch a short video of how do you administer it, but you basically put your 2 fingers in the top of the Narcan and your thumb on the sprayer, and you spritz the person. You tilt the head back and you spritz the person through one nostril. Naloxone takes about 3 to 5 minutes to make an effect, to have an effect in the person's body, and the person can relapse in the overdose. So you can Narcan the person twice or as many times as necessary until medical emergency personnel arrives. I'm going to show a short video about how to use Narcan or naloxone.
If you know someone who takes prescription opioids like Percocet or Oxycontin, or illegal opioids like heroin, then you should know about the risk of an accidental, life-threatening opioid overdose. In fact, over 56% of overdoses happen in private homes beyond the immediate reach of doctors and nurses. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. In this video are instructions for use, as well as the uses and safety information you should know for using Narcan. But first, it's important to be able to recognize the signs of an overdose. Signs of an opioid overdose include not waking up or responding to your voice or touch, breathing that is very slow, irregular, or has even stopped. The dark center part of the eyes becomes very small, sometimes called pinpoint pupils. Fingernails and lips turn blue or purple. A slow heartbeat, weak pulse, or low blood pressure. If someone has these signs, here's how you can help. Narcan nasal spray is a medicine that reverses the effects of an opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information about its use. Please pay particular attention to the indications and important safety information at the end of this video. Also, please see the accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use wherever an emergency opioid overdose happens. Because it doesn't require specialized medical training, it can be given to someone by following these instructions. First, lay the person on their back. Then, remove the device from the box and peel back the package. Hold the device with your thumb on the bottom of the plunger and 2 fingers on either side of the nozzle. Tilt the person's head back and provide support under their neck with your hand. Place and hold the tip of the nozzle in one nostril until your fingers touch the bottom of their nose. Press the plunger firmly to give the dose into the person's nose. After giving the dose, remove the device from the person's nostril and move them on their side, positioning their hands under their head. Call 911 and get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan is not a substitute for emergency medical care. Keep the person under observation. If the person doesn't respond by waking up to voice or touch or breathing normally after 2 to 3 minutes, administer the second dose provided in the box in the alternate nostril. If they respond and the signs of an opioid emergency have returned after Narcan nasal spray is given, then give another dose in the alternate nostril using a new device and watch them closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until they respond or emergency medical help is received. After using Narcan nasal spray, put the device in its box and then dispose in a place safe from children. Narcan nasal spray delivers a consistent, concentrated 4 milligram dose of naloxone that can reverse the effects of a life-threatening opioid overdose in minutes. Visit Narcan.com to learn more.
So here's when you can get naloxone in Brockton. Here are some of the places that you can get it. You can take a picture of it, or you have it in the pamphlet and the resources back there. So what not to do during an overdose? Do not put the person in a bathtub. They can drown. And also, when you get the person wet, the body core temperature drops and the rate of the overdose increases. So don't put them in a bathtub and don't wet the person. Do not induce vomit or they can choke. Do not give them food or anything to drink. If they cannot have it by themselves, they should not be having anything to drink or to eat. As I said, do not put ice down their pants or anywhere else, as the body core temperature can drop and the speed of the overdose can increase. Do not harm them. Do not burn them. Do not kick them. No slapping. No, just do the sternal rub, and if you don't feel comfortable, do the nose and to knuckle action so that the person can respond if it's not in an overdose. And do not inject anything. The body of the person is already compromised, so do not inject anything like insulin or any other medication, because what we can do is put the person in a major organ failure. We are from High Point Treatment Center, and this is my contact information. We have a table with resources at the back. We have the resources in Spanish, in Haitian Creole, and Brazilian Portuguese, as well as in English. So if you would like some resources, make sure to check them out. Thank you so much.
Thank you, Lourdes. So we just wanted to open up the floor for any questions for any of our panelists that anyone might have. Like we said, there's resources. There's a Brockton resource guide in the back with where locations of where to get naloxone, and resources for any assistant with addiction, all in the back of the room. Here we have a question over there. Mm-hmm. Mm-hmm. Yep.
I, I, I don't think yet, right? I think that that's a really good question. Brockton Neighborhood Health Center is partnering with the Brockton Public Schools to do school-based health center, right? And as we, historically have seen the resistance of parents when it comes to sexual education and providing different preventative resources in the Brockton community, I can imagine that there will be a little bit of resistance with having this be a topic discussed in the Brockton community. I am a mom too, so I will definitely be out there advocating for the importance of this within the Brockton community. But we do intend to have substance use resources and support within the high school at the very least. And that's going to be in the near future, but not at the moment that I know of.
High Point Prevention Services does interventions in middle school as well as in high school. Yes.
Mental health associated with addiction.
Mental health associated with addiction.
Actually, can you repeat the question? I didn't hear what you said.
Mental health associated with addiction. Do you provide?
You want to know about services? Yes, so I think there's several organizations here that do substance abuse as well as mental health. In fact, I think most of them would. Brockton Neighborhood Health Center has a full psychiatric team, so does High Point as well, Old Colony Y Mental Health Clinic. There's numerous agencies in Brockton that address, I think any agency that's talking about mental health is also going to be addressing substance abuse because you really can't do one without the other.
And while many agencies offer both, it's important to understand the challenges, right, with that. So oftentimes what happens when a person may be using substances as a form of numbing or not wanting to feel those feelings, right, they may not be as open to having mental health services. So one of the things that we do is we don't create a requirement, i.e. a barrier to getting substance use treatment. So a person who comes to us, we offer the services, but it's not a requirement in order to have substance use treatment. Once a person begins to work on their journey to recovery, they notice that a lot of the feelings that they've been covering up come back. I know Will had expressed some of those from his personal experience. So it's important to understand the challenges of the triggers, right? So with substances, we want to try to avoid triggers in order to remain sober. But when it comes to dealing with trauma and dealing with mental health, we know that triggers are actually welcomed in terms of being able to understand our feelings and to be able to embrace them, and also to be able to work on coping skills that can help us manage those feelings. So it's beneficial to have substance use and mental health together when the person is ready to engage in those services, because having one without the other can create more chances of relapsing as a result of not having those coping skills or not having the medications that are effective in treating their mental health.
Hey, good afternoon, everybody. First of all, I want to say thank you to all the panelists who presented today and give them a round of applause for that. I think you did a great job. Totally awesome. This question is kind of inspired by Will's testimony, because when you said, Will, that something that could be done is to have professionals go out there and connect with people, right?
Yes.
My question for you is, and for everybody really, is what can the average person like me do to help impact this opioid crisis that's happening right now from the time I walk out the door? And what can I encourage other people to do?
Are you an addict?
Yes.
You're an addict?
I'm addicted to everything, yes.
Oh, so you have addictive personality. What I was really trying to reach at is, I really think that the mobile van bus does a really great job, but I was speaking more of walking out into the park, walking to stop and gas, getting out of that mobile van, saying, "Excuse me, sister, would you be interested in some counseling today?" Because that can save a lot of lives. That's what you could do as an individual. It's what I'm trying to say. I'm not knocking any of the work or harm reduction things that have been done. It's just that I know from my personal experience of living as an addict, I'm not saying I needed someone to come and hold my hand, but I know that when we talk about helping the situation, that more nurses, doctors, counselors, and mental health, more mobile vans have needed to be in the country, but in our community. Because, see, I know my park right there by the church. I know Stop and Gas. It's a dangerous place to go. I understand people are afraid, nurses and doctors. I don't know if Alba would go there. But then, you understand what I'm saying? Walking in there sometimes is going to save some lives. That's what I see you as a brother doing when you say you walk out of your door and you see somebody. You don't want to push it down our throats now. You know, that's one thing you know you don't want to do. But sometimes a word of encouragement or a hug sometimes is all an addict out there needs that's missing her children. You understand what I'm saying? Because a lot of times people tend to think that the addicts that are still using are bad people, but they're not. Some of them are hurting, some of them are suffering, and I speak from pain, and sometimes it sounds like I'm making excuses, but I'm not. I'm speaking that they're real people because I tell you, I met professors. I met nurses, engineers, that I slept in the shelter with, that I used with. These people that are just on stroke of bad luck, intelligent people, you know. I'm just saying, you know, I just have so much pain and passion for it. I'm sorry.
So, if I may, just to follow up, I'm hearing a strong theme of connectivity, connection, and just trying to transform isolation into connectedness.
Into connection, you say?
Yeah.
I would agree with you. I guess that's what I'm saying. I talk a lot and ramble on a lot with my passion for it, but I guess y'all can. Like I said, I'm not a professional, but I know that professional help is needed there, you know?
Can I say, I'd like to jump in there for a moment and just add that we need to also clarify that not every person who's dealing with addiction is in Needle Park or homeless. Because you just, Lourdes just said how many overdoses happen at home. So everybody does not need to be an outreach worker, and everybody is not going to be an outreach worker. And for the ordinary person, I would say education as well, because it could be someone in your family who you don't know is using, they could be misusing the medication that they're being prescribed and could have an overdose at home. So I'm thinking for the ordinary person, I would say information, get as much information like you're getting here today, because not everybody is going to be in a homeless situation. That person could overdose at the office.
Also, carry naloxone. Carrying naloxone it's life or death. It's a life or death situation and difference.
To speak on the topic, just everybody, just to kind of piggyback on that, is ultimately individuals are struggling to be seen, to be heard, and to be valued, right? So one of the major challenges that happens is that oftentimes people live with blinders and try not to see individuals as human beings who deserve that dignity and respect. So ultimately being able to make eye contact, being able to compliment somebody, being able to have a conversation with somebody, get to know somebody, right? Get to know their history and their passions.
Hi,
right?
my name is Ginger Morris, and I'm also a representative of Stereo to Recovery. The gifts of recovery. Also born and raised in this town. Glad to be back, and I don't know where I would be without programs like Stairway, without programs like the harm reduction program. Yes, I will speak on the harm reduction and Vivitrol, and a lot of things have saved my life. Recovery for me is a full lifetime thing. We're all in recovery from something. And that's why Stairway, a lot of the members, it's a peer-run center. A lot of the members the peers that are there, Some of them aren't, don't have any issues with recovery. I mean, with substance abuse, but they're recovering from something. We have a whole lot of homeless people, all different walks of life. I found Stairway just on a whim, and I was the first one to be able to take the Stairway to I'm nervous. The Recovery Coach Academy through CCAR, through Stairway. So just keep going, and thank you for everything. See you around.
My name is Rasan Hall, resident of Brockton, also a candidate for Plymouth County District Attorney. I'm interested in hearing from the panelists and also anyone else who is in recovery. You had mentioned this idea that we can't incarcerate our way out of this problem. And as a candidate, but also as a human being, I believe that harm reduction approaches is really what the solution is going to be. But could you speak a little more about the role of the prosecutor's office in not prosecuting people who are struggling with addiction, people who are suffering from substance use disorder, and how that helps reduce this problem and can address that problem?
Well, the mic isn't working, but you know what I think though? You're talking about incarcerating a person that's you're arrested. Are you talking about like a person gets arrested and then they go to jail and then they want to put him in jail?
Right.
That doesn't help me.
Exactly.
All right. 20, 30 years ago, I got busted with some drugs. So I go before the judge. I am an active using addict. They put me on the color code. How is an active using addict gonna pee a clean urine? I did 18 months, okay? Because I could pee a clean urine. Well, I always thought that was a setup and it wasn't fair. I thought that they should implement some type of programs for the addict to help them get clean or something to that nature. I don't know how to professionally bring it about what I'm trying to say, but you know what I'm saying? Yeah. What you're saying, it doesn't work. As in my experience, as an addict, you know, being prosecuted for well, something like that presentation somebody made, that drugs is a crime. It's automatically considered a crime. So if you're arrested, it's like you committed a crime. Whereas, why isn't somehow there should be something implemented that person could get some help? But who's to say who gets the help or not? You understand what I'm saying?
So I think through the years that I've worked in Brockton, I work a lot with the district court, and I think I've noticed increased awareness by probation officers and others in the legal profession, where they're beginning to understand that this is a treatable medical issue, and I think they're far less quick to violate people who are on probation or parole, and they seem to be seeking more treatment options. So whenever I have clients who are on probation or parole, I usually tell them, just be honest with your probation officer what is going on, and really think about what the treatment options are. And I usually try to advocate for them, but I think they're becoming a little bit more sensitive to that. So I mean, obviously we need some kind of legislative change in terms of decriminalizing people who are just dealing with addiction. I'm assuming the district attorney has power, what he can bring forward as a case and what he does not have to. So I mean, they have a little leeway to whether they're going to prosecute this case or not. So a little sensitivity on that level as well. But I think the people, the judges, probation officers, just need to be a little bit more aware of what they're dealing with and really provide more treatment options and less incarceration, because it's not really doing anyone.
Also, just real quick, free to help. I miss you.
Nancy.
Nancy, what was it?
On Thursdays at the courthouse at 2 p.m. They have drug court, and they've really helped a lot of people instead of jailing them. Pam, I can give you the woman's name, my connection, who I grew up with in school, Pam Howard. She works over there, and I talk to her frequently, and she's invited me over. They really, instead of incarcerating, they look out for and try to help treat, because there's a lot of aspects to treating instead of incarcerating, by mind, body, and soul, and also, the judges in the drug court, they're helping a lot more. I just go see them. It's great. It's a great tool.
Thank you.
Thanks. I don't know if that made any sense.
Makes perfect sense, man. Thank you.
Hi, I just wanted to speak toward, Stairway collaborates with MORE, Massachusetts Organization of Addiction Recovery, and what gentleman's been doing, Noel Sear, he's been having Zoom meetings with us on a weekly basis about safe use sites. And how that collaborates, because we all know they're all over the world. They're trying to do that in Rhode Island, but Massachusetts. So what I'm going to try to do is start a petition with the mayor's office and see how many votes that we can get, so it goes to legislation, to the representatives, and then it goes to start a bill, and then hopefully a law, so that we can get that started and maybe get safe use sites. So in the safe use sites, there's doctors, there's nurses, there's recovery coaches, so people are going to use, but just how? And then a safe site, and then there's people there for, like I said, recovery coaching and things like that. So maybe then it'll set the seed for detox and treatment and things like that.
So are you saying the world is becoming more humane?
Amen. A little bit at a time. We can break the stick, but not the pile.
Ooh, I like that.
Thank you. She stole it.
Allow me to clarify the importance of the question that you just asked. If we can manage to get this type of all over Brockton, not just for once in the month, but more often, so we can spread the education. I guess that's where we start, is through education. Yes, there are people that still think that addiction is not a disease. They see it as crime. But in order to decriminalize addiction, we need to spread the education. We need to start educate law enforcement. So thank you all for this gathering, and we need to do more. And that's a beautiful question. Thank you.
Thank you. Am I speaking into this?
Yeah, you won't hear
Okay.
yourself because it's just going straight into the camera.
Okay, great.
But keep it close.
Okay, thank you. Definitely agree, education is important, but my question is, what's after the education? What's after the treatment? What are they coming home to after the treatment, right? My background, I'm a social worker here in Brockton, first with DCF, now with DHCD. So I went from working with family that were taking their kids away because they're doing drugs to now I'm working with housing where we're trying to place them back in a permanent housing, right? But if they're on drugs and they don't have their kids, we can't house them. So after treatment, after rehab, after being sober, what is, I guess, Brockton doing to bring them back into their family, back into housing, back into the workforce? Because I think that's what's going to prevent people from relapsing, right? If I don't have my children, I'm going to go to what makes me feel good. If I don't have a home to go to, I'm going to go to what makes me feel good. And if that drug is my feel good, if that's what numbs me, then that's where I'm going to go to, right? We all have addictive personality. Mine is shopping. When I'm depressed, I'm going shopping. I'm spending money that I have no business spend, right? Because that makes me feel good, right? So same thing with somebody that's over, marijuana or alcohol, whatever it is. They're going to go back to what makes them feel good because what's available to them. So as a community, what are we putting in place for that aftercare? Because I know we're doing all the pre-care and during the care, but what about aftercare?
I think that'd be a good place for the DA to step in too, right? Like seriously. And I almost want to put the question back to the DA. Like, why are we locking so many people up? You know what I mean? Because if we take honest inventory of the new knowledge, it's not really working, right? So.
Thank you. I love this training, but I'm sitting right here and concerned about my community. We sit here, we get all this information. So it's my responsibility when I get this information to pass along to those that really need. Because I don't see, for me, I don't see no mother here that has her son that disappeared for 2 weeks, a month, 3 months. She cannot find her son. She's walking to Brockton neighborhood and crying at the dentist's office because she disclosed to the dentist that she's worried about her son. Okay, we have this information. We need to educate our community. I'm Cape Verdean. And I know Alba? What's your name, Alba? Alba. Alba mentioned about going to Brockton High. When I used to work in the domestic violence field, I'm still doing domestic violence now. I used to go to Brockton High and educate the students on sexual harassment and all the other stuff they're not supposed to do, but, trying to teach them, this is kind of illegal in the United States because I was working with Cape Verdean students. But, in my community, for what I see, and anybody that is in the room is Cape Verdean, please correct me, we don't talk about sex because it's taboo. But I'm pretty sure it's okay for us to talk with their kids about drugs. Because one of the things that Cape Verdean parents have fear of is their kids doing drugs. You can do anything else. But when you do drugs, it's so embarrassing. It's a shame, It's a shame to you. It's a shame to your community. It's a shame for people back home to know that you came to United States and now you're on drugs. And remember, for us, people that is on drugs is the people that is outside on the street. We don't think about those that are overdosing at home, that is doing all this other stuff. So when me and Marina, we see some of our friends that went to school together with us on the street, and talking about this, it makes me cry. We had one that we know that she passed away. She overdosed herself. So when we see people on the street, people that we went to school together with on the street dying, and then we see some people pass by and making fun of them. And because we don't understand, we don't have education about it, so I'm going to see somebody on the street, I'm going to go and tell everybody, oh, do you know why it's on the street? Oh, my God, oh, she's so bad in the United States. I feel sorry for her family. Because now the shame is on me. So now when that person trying to approach the family, is always one person that is there still saying, it's okay, you can come here whenever you want, because the rest of the family doesn't want to know nothing to do with you. Thinking that they are supporting you, but because they don't know that word of supporting, they start comparing you with somebody else's kid. Look at this one. She came to United States 3 years ago. She has car, she has house, she has job, she has this, and you on the street. I think I'm just going to be quiet because I'm going to start crying right now. Thank you so much.
Thank you. One last comment, if we can.
So I wanted to actually talk about that a little bit, to actually give some solutions that can help our community, because even though we come from a different culture, totally other sides of the world, there's a lot of similarities. And one of the biggest challenges is that shame and that guilt. So it's very, very, very important to not feed into that shame and guilt, because what it does is it makes a person feel worse. And when they feel bad, they isolate. They feel like they're separated from God's grace. They're separated from their family, and therefore they go back to using again. So the way to ultimately shift that is to come from a perspective of acceptance and a perspective of forgiveness, so that they can begin to forgive themselves, and they can realize that they're worthy, that they're deserving. They're deserving of having the life that they dreamed of, the life that they thought of that they wanted when they were children, the life, that they're worthy of having that life, right? So ultimately, it's breaking the shame and guilt within the cultural belief system, so that we can come from a perspective of acceptance, of grace, of love, of deserving, so that they can then be liberated from that and ultimately go back to serve their community and to give back to their community. So it's really about working on that shame and guilt cycle, So that way a person can feel accepted and loved where they are. And the way we can look at it is even body shaming, right? So it's like, love myself how I am right now, rather than trying to change myself into, oh, when I'm skinny, I'll start loving myself, right? So love yourself as you are, as opposed to shaming yourself, because all that shame is going to lead to having another cake, another, you know. So it works similar in terms of the shame and guilt cycle. It only leads to further sabotage and negative behaviors. So the acceptance is important.
Thank you.
Thank you, everyone. So this concludes the rest of our panel. I just want to bring your attention to the back on your way out. Please head up the resource table and then just take a scan of a QR code for our event next week. Thank you, everyone, for this event.